I'm Dr. Richard Krasuski from Duke University Medical Center, and I thank you for watching today. Our topic is going to be the accepted treatment approaches to get patients to their goal. So really, in 2017, we want to talk about where are our current strategies, how are we approaching patients? And there really are two approaches that we have current for therapy. First is an aggressive monitoring and escalation of care in therapy, adding or switching medications when it's felt to be appropriate. Our second approach to therapy is a rapid escalation up front with combinations of drugs and adding on drug therapy as is necessary beyond that. So first of all is our aggressive monitoring escalation. Illustrated in this slide is a patient who presents with function class 2 symptoms. They get started on a single agent, so monotherapy gets started. They watch the patient very closely. Once the patient has begun to fail therapy, meaning that they haven't gotten to their particular goals of treatment, they haven't gotten to their 6-minute walk goal, they haven't gotten to their BNP goal, they have not improved their function class adequately, and so that patient is starting to fail therapy, so another drug is added at that point in the middle of the slide. Again, the patient gets a little bit better, but once again, they start to slowly get deterioration, so they're not functionally improving, and then you add a third therapy. So sequential or add-on strategies may buy us time, but oftentimes we're not getting the patients to goal as quickly, certainly, as we would with a more aggressive strategy up front. So our next option here, as you can see on this slide, is rapid escalation of therapy. In this type of patient approach, we're actually thinking we're going to be using multiple drugs right up front. So we start them on a single agent, and you see within 30 days, we're already adding that second agent. So we're ensuring that they tolerate the first drug, but we already have a plan up front that within 30 days, we're going to add that second agent. So you can see the patient starts out here as a little bit more advanced function class. They're a little bit worse than a function class 3 here, and then the drugs are added, and the patient does have some improvement, but maybe it's not as quickly as we would like them to get better. And you can see we add another drug on because there is some clinical data that suggests they're not getting better. And so again, we add that therapy, and now we get more aggressive control of their symptoms. So this is, again, rapid escalation. So in summary, there are really two approaches here that can be utilized. One is to basically do sequential therapy with very careful monitoring and then really add therapies as is necessary based on how the patient does. And secondly is the upfront aggressive management where we're going to add or we're going to put multiple medications on with a plan that we're going to do that up front regardless of how the patient is doing. And either of those at this point in time is reasonable, although we are definitely trending more in the direction of doing the latter. And again, I thank you for your attention.